Over the past week, there has been a 33% rise in daily case counts, with an average of almost 8,100 new cases reported daily.
As Canada's third wave of COVID eclipses the first two, the percentage of Canadians who have gotten at least one dose of a COVID-19 vaccine sits at just above 20%. The U.S., which began vaccinating at about the same time, has seen 36% of its population get at least one COVID vaccine. However, Justin Trudeau says he has no regrets about Canada's vaccine rollout.
Obviously, we worked extremely hard from last summer onwards to sign many different contracts with different potential vaccine makers around the world. And we were among the first countries to start getting approved vaccines into arms back in December.
Canada's COVID vaccine supply is entirely imported, and supply disruptions have become a regular occurrence. Every approved vaccine has seen delivery problems, with Moderna the latest. They're now reporting a one-week delay due to quality control issues.
Because of the nature of the global supply chains, because of the nature of the ramp up that these companies are doing around the world, various vaccine manufacturing sites, obviously desperately trying to maximize their capacity and the output, that there would be from time to time some delays that are inevitable in these processes.
As Canada deals with delivery delays, the question of why we're not making our own COVID vaccines returns. Though Canada has extensive vaccine production, pharma experts say they're designed to make existing vaccines, not cutting-edge mRNA shots.
It's very tricky. It's a very delicate operation to get it to work.
Paul Grutendorf says Canada's existing vaccine production is akin to virus manufacturing, creating flu viruses and weakening them for use as vaccines. mRNA vaccines are still very new, and it's not possible to simply retool those existing facilities. Pharma giant Pfizer has just two facilities in the world making COVID shots, one in Belgium, the other in Michigan.
The mRNA is a completely different beast, right? You're using a very, very, I'd say, delicate procedure. You're trying to replicate RNA strands, and you're wrapping it up in a very small little globule of fat so that it can get into the body intact and get into cells. So this is a very different production methodology.
Grutendorf adds that Canada's patent laws favor generic medications, meaning some pharma companies may find it unappealing to set up shop on Canadian soil. In Ottawa, Xiaoli Li, City News.